Welcome to our workshop. We're going to be discussing fluids and electrolytes today, and the importance of understanding why water and solute can create different forces in terms of transportation of materials from blood side into interstitium and then from there to our cells. So to start, an average person as female adult, about 55% water, and as male adult, 60% water in their body. So it's safe to say we have more than half of the body made out of water. So that means plenty of opportunities to interact with water once you get different substances in the body. And one of the concerns in patients is to have proper hydration. So fluctuation of water volume can greatly impact your patients. One of the concerns is blood pressure, for instance, that we're going to discuss also. So we need to understand there are three possibilities for solutions you will find either as blood, interstitial fluid, and cytosol, that is inside the cells. So possibilities are a solution, basically three. You know that solutions are made of two components. One is called solvent, and the other is called solute. And in general, we're talking about water and anything other than water. Could be proteins, could be sodium, potassium. Since we use sodium in IV solutions, I'm going to use that as an example of solute. So I'm going to put an example of sodium. Okay? So the way we classify solutions and break them into three different classes is based on concentration. So if you have the same concentration of solvent and solute, that term is isotonic. And then the other two versions is either you have greater concentration of solute or less concentration of solute. So practically, what you need to memorize to avoid confusion is that when we say hyper means high and hypo means low, we are referring to concentration of solute. So you don't concentrate on solvent. You don't need to do that. So when you say hypertonic, that means you have high concentration of solute. And when you say hypotonic, you're saying low concentration of solute. Okay? And then whatever you have as solvent is the opposite. So you can kind of predict what the concentration of solvent is. So if solute is high, that means your solvent is low, or the opposite, when concentration of solute is down, your solvent is high. So by kind of concentrating on your solute level, you can pretty much make it simpler to understand. Okay. So now we're going to see why it is important to know hypertonic, hypotonic, isotonic, and all of that. So for that, we got something called net filtration pressure, because one of the main body systems that handles fluids and electrolytes is urinary system or renal system, made of two kidneys, pretty much the size of your fist, and each will have 1 million nephrons, and those are filtration units. And the goal is to pass plasma through nephrons and turn it into filtrate, and then after that, you get to turn it into urine. So that means there are forces involved always when you deal with different environments in the body, okay? So for instance, when we look at capillaries, where we have blood in, you would have two components there. You have plasma at 55%, and then 45% is called formed elements. That's your red blood cells, white blood cells, and then platelets. So in your plasma, 90% of that is just water when the patient is hydrated. Obviously that can change. So under that, you got 90% water, and then 10% everything else. So nutrients could be protein, sodium, potassium, whatever it is that we consume on a daily basis. Okay. So that ratio is normal ratio when the patient is hydrated. And then whatever we have in blood that is based on consumption of fluids and solids when we eat and drink is going to be transferred to interstitial fluid that is basically fluid in a space between cells and blood vessels. So this is space that we have is called interstitium, and then the fluid aspect of that is interstitial fluid. For short, we call it IF. So whatever I have here needs to go to interstitial fluid, IF, and then from there it goes to my cells, so intracellular then. There, and then cytosol is the solution of the cell. So it then ends up in there, okay? So how do we determine what's called gradient or direction of flow from one environment to the next? For that, we need to deal with two basic forces. So forces involved in transportation of fluids and electrolytes, for instance. All right? And those are pretty much two forces. So we are dealing with what's called hydrostatic force or pressure and colloid osmotic oncotic pressure. So in a way, they both deal with movement of water, but in a different way. So we need to clarify how they are different from one another. When we say hydrostatic, it has to do with body of water. So how much water basically you have in one environment versus another environment. So if I'm back here, the amount of water I have here versus here would dictate the direction of flow or gradient. So basically we are pushing water, when we say hydrostatic, we are pushing water from high concentration side to low concentration side. So that's hydrostatic. So simply put, I can put this pushing water from high concentration to low concentration site, whatever that site is. Okay? And then oncotic has to do with colloid, that means presence of solute or other molecule than water. Could be proteins, okay? Could be electrolytes. So this actually pulls, so pulling water towards higher osmolality side. So what is osmolality or osmolarity? Based on presence of electrolyte, so molar value of an electrolyte per liter of water or per kilogram of the body weight is called osmolality. So what I need you to take from this, to make it simple, is this, to understand the direction of flow. So if you increase solute concentration, okay, it will increase osmolality. That means in a way you are increasing osmotic pressure. So whichever side that has got greater concentration of solute is going to drag water towards it. That's why it's pulling water. Okay? So in both cases, we're dealing with movement of water, but using two different mechanisms. Okay? So if we come back here, the reason why we have generally higher concentration of water and solute because we keep on eating and drinking. So it makes sense to have more of that in your blood, right? So here, you're going to create greater concentration of water, okay? We're talking about 90%. So an average person that has about 6 liters of blood, practically half of that is water, so if you do the math. So you have plenty of that. So you're going to have greater concentration of water. That means you're going to have a great force called hydrostatic. And then moving that way, it would be my hydrostatic pressure. Due to what? High concentration of water, because you got plenty of water in your capillaries. So water is going to go this way. So if you're dealing with pretty much everywhere in the body except kidneys, pretty much you're looking at 30 millimeter of mercury pressure. And in general, you will have it opposed by 20 millimeter of mercury pressure from interstitial, and then you end up with about 10 millimeter of mercury pressure greater on capillary side that forces the water that way. Okay. So another thing that is important to understand that is behind hydrostatic pressure is actually blood pressure. Okay. So we need to know what blood pressure is. Blood pressure is pretty much the force exerted to the walls of blood vessels by blood. That's what it is.
Baroreceptors.
Baroreceptors will be receptors to detect that as maintaining homeostasis and all that. So simply put, to understand this, we can say if we increase water concentration, okay, in blood, right, that increases blood volume and you increase blood volume, that increases blood pressure. Because now you have more blood to push against blood vessels walls. So this will give you higher blood pressure. So that's another reason why we need to maintain proper balance between fluids and electrolytes. Because one of the concerns is hypertension that we have to handle. Okay? So when you look at this, and then you bring that here, so another force that is behind hydrostatic pressure is not just same body of water or the amount of water. Remember that as you increase this, it will increase blood pressure, so it pushes it towards the wall. So in case of capillaries, you're going to have gaps, fenestration, okay? And those are designed to allow only small molecules to cross, not big ones, okay? But what makes it difficult to understand is that this can change. Those gaps can get bigger. How? If you have a patient that is responding to hypersensitivity or allergic reactions, or they have infection. Due to release of histamine, you get to have these gaps enlarged. And it's basically designed to allow white blood cells to go out and fight.
Is that different from dilation of the actual capillary? Or is that what they're talking about?
This is the wall. Dilation of capillary, you're looking at the capillary that expands
So both
due to pressure. But those gaps will kind of stretch under the influence of histamine. Histamine that is released in response to hypersensitivity reactions or presence of some kind of infectious disease. And that can change things, right? That can change all these forces that we are dealing with. Now, why is it really important for us? When you go back to a specific part of the body called renal system, we get to handle what's called net filtration pressure. Okay. Net filtration pressure. That gets to deal with total pressure outward versus total pressure inward. So by saying outward pressure, minus inward pressure is equal to net filtration pressure. So I'm going to make it more specific here, okay? So I'm going to use my capillaries here that demonstrates transportation of materials to our cells. I'm going to erase this and then move to the other side. So now we have capillaries, but since we are in kidneys, capillaries become specialized, called glomerulus, that is received by Bowman's capsule. And so I'm going to close this on this side and then bring it to this side where you got hydrostatic pressure still, same deal. That is going to go this way. And this would be part of that tubular nephron. Because you got a Bowman's capsule, right? So you got the Bowman's capsule, kind of like that. So your typical nephron. And you have capillaries bringing blood in there. And then you have capillaries surrounding the tubular aspect of your nephron. So to bring plasma of glomerulus in here, you have to pass through filtration system that you got slits, you got fenestration, and you have podocytes to ensure that large molecules won't cross, right? So basically you're looking at, let's say, a segment there. enlarged. So you see the capillary, and it's going to be glomerular, so I'm going to put letter G for it, glomerulus, or glomerular capillaries. And then when we try to get to this, so this would be part of the nephron, okay? And then first we're going to treat it as right here, how you bring plasma in here, and then we get to deal with the exchange. So you have basically two places where you get to regulate what needs to be kept in the body, what needs to be get rid of in terms of urination and leaving the body. So the beginning of that process is when you have capillaries facing capsular side, okay? So what it is that if I turn this into capsular side just for a second, then we go back. We're going to have hydrostatic pressure dictating as the most dominant force in net filtration pressure. The most dominant. Looking at 55 millimeter of mercury pressure at that level, coming from glomerular side. This is going to be opposed. Okay, so this outward. So the term outward versus inward uses capillaries as reference. So if you're going out of the capillary, you call that outward. And if you're going into the capillary, you call that inward, right? So this is the outward force at 55 millimeter of mercury pressure, and then it's going to be opposed by two inward pressures. That means you're going to have also water from the other side, okay? So this would be my outward. So if I put net filtration pressure, my outward force is hydrostatic pressure, right? But this is the glomerular side, so I'm going to put letter G, so hydrostatic pressure with the letter G in front of it. Like that. So that's my dominant force. And then it's going to be also opposed by hydrostatic pressure. That means you're going to have water on the other side, but it's not as strong. So this would be also called hydrostatic pressure going against, opposing this force. So that's also hydrostatic pressure, but this is on capsular side, so we're going to use letter C. So one of the inward pressures, one of the opposing forces that I have here is going to be my hydrostatic pressure on capsular side. Okay, well, we're not done yet, because also here I have other than water. In my plasma I have also so electrolytes and things that increase osmolality. So the osmotic, okay, so I'm going to have electrolytes here, and that is going to attract water. Remember that? So you do have another opposing force that is due to presence. So presence of solute in capillaries will create osmolality, which is your osmotic force basically, right? Oncotic osmotic force. Osmotic pressure there. Okay. So although solute is inside capillary, it's going to pull water towards it. So it's going to help that force. So these two, so the osmotic pressure that is coming from glomerular side, because it's inside capillary, but the direction is that it's going to attract water, so it's going to work with the other force. So these two are considered as the inward or opposing, right? So what I'm going to add here is the osmotic pressure from glomerular side. And that is 30. So here we got 15 millimeter of mercury pressure, opposing 55, and then since it's attracting, so that this is about 30 millimeter of mercury pressure. So these two need to be combined, going against the primary force here. So if I plug in some numbers, my net filtration pressure is 55 millimeter of mercury pressure. That is my hydrostatic glomerular force minus, combining the two, 15 millimeter of mercury pressure plus 30. That's going to give me 55 minus 45 equal 10 millimeter of mercury pressure. So my net filtration pressure, normal net filtration pressure is 10. So what it means is that using these forces based on concentration of water and based on concentration of solute, we get to overwhelm those two, and that's how you get to push blood into nephron and passing through filtration membrane and all that. So minimum of 10 millimeters of mercury pressure is required to actually make urine. So if you don't have that and you have equal pressure on both sides, there is no filtration. You're not going to be able to get in, so that's kidney failure. So you're seizing urine formation basically. And that's not what we're looking for. That's why in many of my classes I say homeostasis is not equilibrium. Because to maintain homeostasis in most of the time in physiology, we're not supposed to have equilibrium. So we can move things. Because if you have equilibrium, equal forces, there is no transportation, there is no movement. So are there instances where you have problems here, where not only you get to send small, like sodium, potassium, glucose, and water to your nephron, but also you end up leaking or sending proteins, for instance. Absolutely. Okay. So that's where you get to do urinalysis and find protein in urine. That's proteinuria. You're not supposed to find that. So when we find that, that means that we got a problem there. Okay. So that's another reason why we need to worry about fluids and electrolytes in our body, because that directly interferes with transportation of gases, nutrients, water to our cells. That's the whole idea, to send them here, number one. Number two, removal of metabolic wastes. So we have to remove that and get rid of it. Urination, defecation, exhalation, all of that. You're not going to be able to do that at cellular level if you have problems with these pressures. Okay? So another concern or reason why we need to know about fluids and electrolytes is a condition called edema. Okay? So edema is accumulation of water here. In interstitial fluids. Okay? And that you get to pretty much divide it into pulmonary edema or systemic edema everywhere in the body involving accumulation of fluids. So if we lose balance between water and electrolytes, for instance, we